So I look after blood and marrow transplant in this hospital, and we do need blood and marrow transplant as a procedure for many of our patients, both children and adults, who suffer from several hematological blood disorders or even blood cancers. And in these cases, quite often, the bone marrow transplant or the stem cell transplant remains the final treatment of cure. For this purpose, we need donors. Of course, like a stem cell has to come from a normal individual for that particular child or adult. The best person in such a situation would be their brother or sister. Unfortunately, we only get a fully matched brother or a sister for any individual just in about 30% of the cases. So, in the vast majority of the cases worldwide, we do not have a sibling or a brother or a sister who would be fully matched as a donor for this particular case. In such situations, we need to look towards unrelated donors, and these could be volunteer donors who do not have any financial incentive.
Hello, good afternoon. This is Dr. Ashutosh Sharma. I'm the medical superintendent at this Amrita Hospital, Faridabad. And it's a proud privilege for us to be getting into an MOU with Give Life Foundation. And for this, I thank Bart Fisher being here and welcome him to say a few words.
Thank you. Thank you for small registries, but India needs 80 million HLA marrow-type donors because India is so huge and such ethnic diversity that you need a big registry. You're looking for a needle in a haystack. Literally, it's a numbers game. You need a massive promotional campaign. We're calling it the Swab for Life campaign. A swab, with that, and you're in the registry. And what we do is we go to a laboratory with that swab, and we type it, and it enters a computer base, actually. This is an information technology exercise in large part, which is also relevant for India, which is so strong in software development and IT, and going forward, artificial intelligence. So after the registry, after your swab, you're in the registry, and then the job is to find a match. There's a patient in need, say here at the hospital has leukemia, needs a bone marrow transplant. You have to find a match, and there's in the registry. And what this means is if you are in the registry and you're a match, someone tells you you're a match, in America, our experience is 95% will do the match. We'll actually go through with the operation. In India, it's somewhat less. And one of the reasons is the lack of insurance to pay for it. Because once you find you're a match, there's an operation, it's bone marrow transplant. That's what we say the hospital here would do. But we need more insurance coverage in this country. And we are working to establish private-public partnership for insurance so that people here can actually pay for the operation that they need. And what we do is, let's say we find the match in the U.S., we put it in a pouch, it comes with a courier to India, and it is used. The patient doesn't have to move. The patient in need is there in the hospital. Make people feel good. And what I want to emphasize is that we were just at the Vatican, in fact, for an interfaith conference, and what a deeply symbolic and religious act this is, because religion is the quest for perfection through acts of kindness and compassion for others. And this is the ultimate act of compassion for others. You're saving their life. And no pain, really. It's just a blood transfusion. So at the end of the day, what we're doing is we have some registries here. We need a much larger one. So Amrita is the perfect partner for us because of this humanitarian spirit of Amma, the hugging mother, and the whole origin concept of the hospital here, which is one of service. It's not like the greedy hospitals we deal with in America. It's service, it's compassion. It's not about money, it's about saving lives. And we can do it. We can save many lives. Right now in India, only 10% of the people who need bone marrow transplants can find them through the registry. It's just too small. It's a big numbers game. So we're just thrilled to work with Amrita. They're wonderful people. They have a great facility here, and also in Kerala. So we intend to
treating and curing. This is a very important thing. आज का कैंसर होते हुए सब लोग ट्रीटमेंट करते थे, कीमो हो या जितने भी वो ट्रीटमेंट्स है वो चलते रहते हैं, लेकिन ये जो बोन मैरो है इट्स क्यूरेटिव, क्योर हो जाते हैं। एंड इसमें फर्क ये है, मैं खुद इतना सुन के आश्चर्य हुआ कि पहले सर्जरी करना पड़ता था, हिप से मैरो निकालते थे और उसको बहुत पेनफुल, एटलीस्ट 1-2 दिन के लिए दर्द होते थे, तो काफी लोग इसके कारण वो मानते नहीं थे करने का। लेकिन ये स्वॉब मतलब जैसे हम कोविड के टाइम पे जाके यूज्ड टू टेक अ स्वॉब, ये करने से यू कैन बिकम पार्ट ऑफ द रजिस्ट्री। आपका कुछ खून निकालना, कट करना कोई जरूरत नहीं। और इसके बाद अगर आपको मैच मिला, यह है सबसे बड़ी चीज, आपको सर्जरी की कोई जरूरत नहीं। जैसे खून देते हैं हम, वैसे इस ट्रीटमेंट में सिर्फ खून से निकलते हैं और ट्रीटमेंट से बनते हैं जो बोन मैरो, which can save a life. So बहुत बड़ा एक मोमेंटस मूवमेंट है इंडिया के लिए। एंड सबसे ज्यादा डॉक्टर फिशर और अमृता हॉस्पिटल मिलके ये सबको हमने देखा, थैलेसीमिया के बच्चे, छोटे छोटे बच्चे हर 2 हफ्ते जाके ब्लड ट्रांसफ्यूशन करते हुए वो बचना नहीं ज्यादा दिन, बिकॉज दे पास अवे आफ्टर सम टाइम, आई थिंक 10 years 15 years। लेकिन इसमें फर्क क्या है, मैच मिलने के बाद वो बच सकते हैं। सो इसीलिए ये अमृता हॉस्पिटल और डॉक्टर फिशर का मूवमेंट इंडिया में बदलाव आ सकते हैं। और दूसरी चीज, जो इंश्योरेंस कंपनी बात कर रहे हैं, ये आते, it can actually provide the support, financial support as well. So ये बहुत बड़ा मूवमेंट है इंडिया में, हर एक को जहाँ पे जरूरत है, होपफुली हम लोग प्रोवाइड कर सकते हैं। On that note, Dr. Fisher, why you started and why did you come to Amrita? This is a very important thing. Why did you choose Amrita Hospital and why India as far as Amrita goes?
Well, I got into this 40 years ago when I set up the Registry in America. And I lost an 8-year-old son because there was no match. There was no registry. And under the laws of genetics, it's 1 out of 4 chance that a sibling, brother or sister will be a perfect match. And you get what you call related sibling bone marrow transplant. But if you don't have a family match, you got a problem. So you have to have outside what we call unrelated marrow donors. And that's what the registry is. It's a listing of potential donors. So, as was indicated, it's
In-house, correct?
That's correct. So we do have a very large dedicated research facility that's doing a lot of groundbreaking research in genetics, stem cells included. And the intent of this research is to ensure that medical development is done for the benefit of society to bring down costs of treatment for various ailments.
So with that said, जड़ पे जाके जो क्योर करना, क्योंकि सब लोग जाते हैं ट्रीटमेंट करने, हम लोगों को ये समझाना चाहते हैं कि ट्रीटमेंट तो करते रहेंगे, लेकिन क्योर, उसको अगर हम जड़ से हटा सकते हैं, वो एक तरीका है जो बोन मैरो के माध्यम से। And hopefully, with this great, God willing, with all the blessings of Amma, I think this is a great movement जो मिलके कर रहे हैं। And इससे, जैसे मैंने बोला, हम लोग 500,000 जान हर एक साल बचा सकते हैं। And with that said, a great, give a big hand to Dr. Bart Mishra for bringing this down, and to Amrita Hospital for this. And I would like both of you to show the MOU. It's a great movement out here that you have begun.
And so we look forward to a very fruitful relationship for helping society at large and helping the Indian population. Thank you very much, Dr. Bart, for coming here today, Dr. Sanjaanaa for coming here today. We truly appreciate your presence, and we look forward to a very fruitful engagement and relationship. in serving humanity at large through this MOU. Thank you very much.
हॉस्पिटल में जो आज यहाँ पे कॉन्फ्रेंस किया गया, क्या उद्देश्य रहा, क्या पर्पज है आज की इस कॉन्फ्रेंस को?
आज हम इधर पे गिव लाइफ फाउंडेशन जो डॉक्टर बार्ट फिशर ने शुरू किया 40 साल पहले बोन मैरो रजिस्ट्री के लिए, और 47 मिलियन रजिस्टर्ड लोग हैं उसके अंदर, और उसको पहली बार इंडिया ले आ चुके हैं, और एशिया का सबसे बड़ा एंड बेस्ट इक्विप्ड टेक्नोलॉजिकली एडवांस्ड हॉस्पिटल जो सबसे ज़्यादा लोगों का सेवा भी करते हैं, अमृता हॉस्पिटल जो राम गणपति जी आज है इधर पे, उनके साथ मिलके इंडिया में अब रजिस्ट्री को बढ़ाने के लिए, और जितने लोग हम इस माध्यम से बचा सके, क्योंकि इंडिया में आज तक जो चल रहे हैं ट्रीटमेंट, क्योंकि जो चलता कीमो हो जो भी हो, इट्स ट्रीटमेंट नॉट क्योर। क्योर का मतलब है बोन मैरो रजिस्ट्री जो मिलेगा मैच मिलने के बाद जो भी वो बीमारी कैंसर रिलेटेड हो, थैलेसीमिया हो, उसको क्योर कर सकते हैं। तो ये बहुत बड़ा मूवमेंट है, और डॉक्टर बार्ट फिशर एंड राम गणपति जी इसके बारे में थोड़ा बात करेंगे। ओके, यस
सर मैम आप पूछ रहे थे कि आज जो आपने MOU साइन किया है?
Yes, so Dr. Fisher, you've signed the MOU with Amrita Hospital.
Yes.
And what does this entail?
This means we will have Amrita Hospital as a sponsor of our Swab for Life campaign, which is designed to get more people into the registry as voluntary donors. And the ability of Amrita at the end of the day to treat the patients is critical. And the idea is to be able to do that at an affordable cost. And that's the issue. I mean, we have to have better insurance and ways to pay for the match and the operation once we find the match. But Amrita is a perfect partner, has the largest hospital in South Asia. His facilities are here to do the work. And we know how to get the match, but the big problem is awareness. Most people really don't know how easy it is to save a life. And just you swab and you're in the registry, and if you find your match, it's like a blood donation. And at the end of the day, it's a very easy way, probably the one time in your life, you'll have a chance to save a life. And it's very ennobling, and it's very relationship building. We develop these amazing relationships between the donor and the donee, and it's very inspiring, actually. And this is truly an international movement. Our goal is to build one human family. We're one human family. We're same cell, same blood. At the end of the day, this is a perfect way to improve the relationship between India and the United States, a healthcare bridge. And so we're very excited. We have the right partner because of the motivation here is humanitarian. It is service. And so my job is to bring in insurance companies and CSR, what we call corporate social responsibility programs in India for the Indian companies. So they'll sponsor drives even on their own companies for their own employees, you know. So it's a combination of more insurance through public-private partnership and CSR programs, these corporate social responsibility programs. And after all, the state gives the charter to the company to operate. The company has a responsibility to the community. And this is a perfect program because they can save the lives of their own employees. You know, they can type their people and then use the outcomes to save lives. So, but we have the perfect partner. We're just so thrilled to work with Amrita and hugging mother.
सर क्या कहेंगे आज जो MOU साइन हुआ है वो लेके, तो इससे कितनी बेनिफिशियल होगा तमाम जो जरूरतमंद लोग हैं, और कैसे आप लोग इसका फायदा कैसे उठा सकेंगे?
डॉक्टर संजना बोला ना, और डॉक्टर बार्ट भी बोला, पहला चीज़ है लोगों को पता ना चाहिए ऐसा एक अरेंजमेंट है, ऐसा बोन मैरो रजिस्ट्री हम शुरू किया है, एंड पीपल कैन गेट रजिस्टर्ड वेरी इजीली। इसमें एडवांटेज क्या है, सिर्फ एक कॉटन स्वैब आप मुंह में डाल के वो रजिस्टर कर सकता है, सिर्फ वही करना है। और उसके बाद मैच होने के समय आपको डॉक्टर संजना बोला सर्जरी कुछ नहीं करना है, पहले बैक में सर्जरी करके बोन मैरो एक्सट्रैक्ट करके वो सब करना था। अभी सिर्फ ब्लड देने के वजह से यू कैन बी अ मैच एंड यू कैन सेव अ लाइफ। Incredibly important initiative, and Amrita Hospital is very proud and glad to be part of this initiative. And more than initiative, as Dr. Bart and Dr. Sanjana mentioned, awareness, creating awareness is very, very critical for this initiative. Just like we are working in creating awareness for organ donation, where people are not aware that donating their organs when they die or can save other lives. This is very similar to that. You don't have to die here to save another life. That's the best part. While you're living, you have the opportunity to save another life by just donating your blood if there is a match. So it's a great initiative. We have to create awareness where it is very simple to register as part of this registry by just swabbing your inside of your mouth. And if there is a match, by just donating your blood, you're able to save a life. So it's a great opportunity. Please do consider becoming a part of this registry, because I'm going to become a part of this registry. Thank you.